In this podcast, we will talk about the connective tissue stretch. The connective tissue stretch is excellent for improving joint flexibility after prolonged immobilization. It uses a combination of heat application, long-term passive stretch, and cold application to help improve joint flexibility after a prolonged period of immobilization. The connective tissue, which are the tendons for muscles and also the joint ligaments, which surround the joint that has been immobile for an extended period, oftentimes thickens and becomes stiff, a condition known as a contracture. The connective tissue stretch works to reverse this process. The heat causes these fibers to relax, the stretch lengthens the fibers, and the cold application enables the fibers to reattach in the lengthened state.
So precautions and contraindications for connective tissue stretch. If any exercise or activity causes pain, the treatment should be stopped. If you are hypersensitive to cold, you should not use this modality. If you have normal range of motion or more than normal range of motion, you should obviously not use this modality.
During the application of the hot pack, it will feel very warm. It should still be comfortable, so if it gets too warm, extra layers of toweling will have to be added. When the stretch is applied, you should feel tightness in your affected joint. If you have pain, less weight should be used. If pain continues with the lowest amount of weight, the connective tissue stretch should be discontinued. When the ice bag is applied in place of the hot pack, it will feel cold and achy before finally going numb. The achiness and pain experienced during the ice bag application is normal.
Connective tissue stretch protocol consists of 30 minutes of hot pack application to the affected muscle. 30 minutes of passive stretch of the affected muscle begin at the 15-minute mark of the hot pack application. After 15 minutes of passive stretch application, the hot pack is removed and replaced by an ice bag for an additional 15 minutes. Both the ice bag and the passive stretch are removed at the same time. Total treatment time for connective tissue stretch is 45 minutes.
The following items will be included: a heat pack, an ice bag, some kind of pulley system, a rope, and some weights.
Following is a connective tissue stretch for the quadriceps muscle group. First, we'll start with a moist heat pack for 15 minutes. After 15 minutes of the moist heat pack, we will add in the continuous passive stretch. The stretch will be done for 30 minutes, and the first 15 minutes we will keep the hot pack on that quadriceps muscle group, and after 15 minutes we will switch out the heat pack for an ice bag and continue the stretch for 15 minutes, and after 15 minutes we will end both.
Connective tissue stretch for the gastrocnemius and soleus. So first we'll apply heat to the gastrocnemius and soleus muscles for 15 minutes, and then after 15 minutes we will apply some stretch to lengthen those fibers in the gastrocnemius and soleus with the pulley system, and we'll continue to apply heat for 15 minutes. After that 15 minutes, we will now apply ice to attach those lengthened fibers to their new position.